As we begin our mobility exercise journey, I wanted to start with breathing. Breathing is the basis for having relaxation with movement, being able to move through things, being able to adapt to pain. Breathing is an unconscious thing that we do all day, but focusing on breathing and being able to adapt your breathing to different stimulus is really important and takes some time to learn. Everybody's heard about their core before. So I describe the core like a box. You got your abs as the front of the box, your back muscles, the back of the box, your obliques, your side abdominal muscles, sides of the box, your diaphragm's the top of the box, your pelvic floor is the bottom of the box, okay? So you got this cube, everything has to work together. So if you think about, holding your breath to push, holding your breath when you sneeze, women that have had pelvic floor issues, guys and gals that have leaking whenever they cough or sneeze. As we age, that pelvic floor gets weaker. We have to train that, and a lot of times you coordinate that with breathing as a conscious effort to work with. So we'll get through, incorporating some of that with our specific mobility exercises, but in general, mobilizing your core is important to be able to stabilize later on whenever we start doing exercise. So I want everybody to put a hand on your chest and a hand on your belly and just take a couple big deep breaths in through the nose, out through the mouth. And as you do that, see which hand moves more, your chest hand or your belly hand. Big deep breath in through the nose, out through the mouth. Whenever you breathe in, does your chest hand move more or your belly hand moves more? Because we're taking that big deep breath in, thinking we're pulling up and getting all the air in the lungs, and we've been trained not to poke our bellies out. Well, that's actually, you're using what we call accessory muscles to do that. You're kind of pulling up on your lungs. Now what I want you to do is that as you take that deep breath in through your nose, I want your belly hand to move more than your chest hand, okay? So your belly should be poking out as you breathe in, and as you breathe out, it goes back in. So breathe in through the nose, belly comes out, breathe out through the mouth, belly comes in. As you do that, whenever your belly comes out, what you're doing is you're pulling down on your diaphragm, and that's pulling down from the bottom of your lungs and pulling air in, as opposed to using muscles up top, the accessory muscles at the top of your neck and chest, to pull up on your lungs to force that air in. So if you think about a baby, if you watch a baby sleep, because that's the way we're mechanically designed to do things, is breathe through the belly, and that diaphragm pulls down on the lungs. And as we age, and like I said, we're kind of trained and conditioned to not let our bellies poke out, and you got to keep that belly sucked in, and end up using these other muscles. In order to mobilize everything the right way, you want to use that breathing pattern. So hand on the chest, hand on the belly. You can do this sitting, standing, laying down, whatever works for you, and work on breathing and working through breathing in through the nose and poking that belly out, and breathing out through the mouth and bringing that belly in. Just nice and easy, back and forth. And then the more you do that, we'll get into coordinating that breathing whenever we work on the thoracic spine and the lumbar spine and the neck, and coordinating that breathing with that. So the more you can get in the habit of that, the better. So just general breathing. First mobility exercise is breathing, mobilizing that diaphragm to help work the lungs, the ribs better. So give that one a try, then we'll talk about some other ones. All right? Thanks, y'all.